Hi, my name is Dr. Raja Adnan Ahmed, and I'm a consultant psychiatrist currently working in UK. And I'm doing an interview series on career guidance, and I'm inviting some of the successful IMGs who are working in really good specialties and working across in the UK. With me for this interview is Dr. Shifa, who's who's an IMG from Pakistan. He did his medical graduation from Rawalpindi Medical College. And he's currently working in UK on a dual training of anesthesia and intensive care medicine. I thought it would be really good to for him to come and share his experience with us, so the IMGs who are looking into these two different pathways can get some inspiration and get some guidance. Dr. Shifa, thank you very much for joining us. You know, it's a great pleasure to have you on this forum. Would you like to tell us about your journey a little bit?
Assalamualaikum, bismillahirrahmanirrahim. First of all, Doctor, thank you very much for inviting me on your show or channel, should I call it. Yeah, so it was, for me, it was a very straightforward decision that I knew I'm going to finish my graduation, I'm going to come to UK, start practicing here. I'm not a strict IMG because I had British nationality, and that gave me a bit of an advantage, but I don't think it changes things in long term if you've got a nationality or not. The only thing it's probably going to change is your visa status, which some of you will have to apply for a tier 2 visa if you want a specialty training post. So when I came over, I started off from house job or house, which is known in other countries. Over here, it's called foundation training. And I started my foundation year 1. When I started off, I strictly wanted to be a physician, specifically a cardiologist. But as I moved into training in NHS, I found out that a lot of training specialties here are a lot different from back home. I'm from Pakistan. A lot of you might be from other countries. So this is something you might have to be flexible about and keep an open mind for, because what you're expecting might not be the case when you actually arrive here. So anyways, I did a few taster days, so you can have some experience in different specialties. I did a few taster days in cardiology. I went into their cath lab, saw a few interventions, and after a while decided that probably that's not my cup of tea. And hence, I became more flexible in my foundation year 2, so the year 2 of my house job, okay? And used that time to reflect more on what kind of specialty I'd like to go into. I've always been a differential diagnosis kind of person, so I always liked fields of medicine where you have to think about diagnosis and arrive at a decision and then treat it. So I wanted one of the acute specialties, and I chose for ACCS, which is known as the Acute Care Common STEM. So it's a core training pathway, which basically leads to 4 different fields of medicine. You can do acute medicine or general medicine. You can do intensive care medicine if you've done ACCS, anesthetics, and emergency medicine. Another important point is if you've done acute care common STEM in acute medicine, you can then even opt for other specialties of medicine, let's say renal or respiratory cardiology, if you want to later on. So I went into it. I actually did all the interviews, and that was the whole point. I did ACCS intensive care. Sorry, you cannot do ACCS intensive care. I did ACCF emergency medicine, acute medicine, and anesthetics. Intensive care is a bit different, so I think I'll talk about it a bit later. And I got offer from ACCS emergency medicine and ACCS anesthetics, and that's when I decided I'd probably go for anesthetics because you end up doing all of the specialties anyways in the ACCS program. When I was doing my ACCS, I kind of figured out that I liked intensive care a lot. But at the same time, there are further repercussions of being an intensive care consultant, which I think we'll talk about in a while as well. So that kind of made me decide I probably wanted to dual train, so not to do intensive care on its own, but also do a second specialty, which was going to be anesthesia for me. But don't take me wrong, you can do intensive care with emergency medicine and acute medicine as well. So there are different options that you can choose, but I wanted to do it with anesthetics. And that's why I applied into the specialty training program. How easy it is. So to give you an idea, I applied on both anesthetics and ICU, and I got job offers for both, albeit from different parts of the country. So I went for the option which was more suitable for me, and then I reapplied for intensive care in the same part of the country, and I got dual training in the same part of the country again. So it's, I think at the end of the day, it's about what you want to do, how committed you are to that specialty, how much time you want to spend preparing for it, and how much experience you want to gain in that specialty. I think if you are committed to that specialty, it is not difficult to get a training program in that specialty. Now, I'd stop there. I'm not talking about surgery. I'll leave that aside for more expert people. I'm just talking about medicine, intensive care, henceforth. If you're really committed and if you want a job in these specialties, there is no reason that you wouldn't be able to get a job as a trainee in these specialties.
And that's a very good thing to say. I think a lot of IMGs sort of wonder which specialties are easy, but I always say, you know, if you really put your work down, you know, if you work hard and think about the specialty and make your portfolio towards it, you know, you can always gain anything. I mean, you mentioned you already had a British nationality, but nowadays the way the visa rules have changed, you know, you don't have to have British nationality to go in a certain specialty. As long as you have got a good portfolio and you can pass the interview stages, you can apply for any training in any specialties. In terms of going for the anesthesia, would you like to share your experience of, you know, if somebody is thinking about going in anesthesia training, what should they be doing right now? You know, if they're working abroad in Pakistan, India, or they are here already, how can they sort of think about it?
So I break it into two parts. I break it into people who are coming from abroad and want to enter anesthesia training here, and I'd break it down for people who work within UK and want to do anesthesia training. Because let me be very frank about it. Anesthesia training out of this country is entirely different from how it works in this country. In other countries, people don't even know an anesthetist. They're thought more of as a surgeon's assistant who just get them to sleep. But over here in this country, anesthetists are allocated and delegated a lot of other job roles as well. So it is an independent specialty on its own. It's got a lot of responsibility attached to it. When you are a fully qualified anesthetist, it is one of the only specialties in the whole country where you do sole practice. So you don't get enough time when you're practicing to discuss cases with your colleagues. So it is a bit different. And also all of the different specialties will look up to you at some point in their career because you will be the senior most go-to advice person in the whole hospital. So training anesthesia in UK is much different to training anesthesia where I come from, which is Pakistan, where it was a bit different. And to be very honest, it didn't inspire me over there. Now coming to how to get into anesthetics. As you will all know, once you start working in NHS, you will have some sort of paper evidence of what training or what experience you have. In some parts of the world, it will be called a portfolio, or the parts of the world you'll have evidence of some sort lying around. So over here, it's an online portfolio, and you just need evidence in that portfolio of various activities that you've undertaken. I would definitely go through the selection center criteria. So anesthesia has a national recruitment office, which is situated in the Northwest Deanery, so Manchester to be precise, and they've got an online resource called Anaesthesia National Recruitment Office website, ANRO. If you search it on Google and say ANRO Northwest, it will open their website for you. If you go into that website, it will have selection criteria for core trainees and for specialty trainees. And there are two different documents, and that document will tell you everything they're actually looking for in their core trainees and their specialty trainees. Now, if you're starting as a core trainee, I'd say have a look at that document and start working on getting some points over there. Now, when you're working for those points, you have to make a conscious decision there. So some things will get you more points than the other, but at the same time, you'll be investing a lot of your time into getting, let's say, 2 or 3 more points. For example, if MRCP is an exam which gets you 2 points in post-graduation versus completing an audit cycle gets you 5 points in the process, maybe taking MRCP exam, booking for it, then paying for it, then revising for it and taking the exam altogether is about 6 months worth of journey. But if you put the same amount of time, you can very easily complete the whole audit cycle. So it's your conscious decision that you have to make which one you want to go for. If personally it was me, I'd go for the audit cycle because I don't have to spend extra money on it. It can be done on my personal time, and it gets me more marks for the core training sheet. Now, whichever specialty training program you're applying for, you'll have to go through that selection center criteria and self-scoring scheme. And basically that document tells you exactly what they're looking for in their trainees, and that is what they would like to see in you. I would utilize my time straight from the outset. For me, I was, as I said, when I came into UK, I was more of a physician-minded person, but the good thing about anesthetic training is they give you extra points for training in other specialties. So if you, let's say, spend less than 24 months in pediatrics or acute medicine or any other branch of medicine, you get extra points awarded for that. So if you took your time to decide that you want to be an anesthetist instead, you don't worry, you'll get extra points just for doing that. But be mindful that if you do more than 24 months, you don't get any point, because by that time it more kind of counts as you've been wasting your time instead of trying to get more experience. Postgraduate degrees, I didn't have anything other than my graduation. That's certainly something to start working on, and it's very easy to get points for post-graduation. Now let me tell you how. I'm currently doing a postgraduate study in medical education. It's distant learning, it's all online. You hardly pay £2,000, and if you are in a good hospital in a trust grade post, they will probably finance you for it. As I said, it's distant learning, so you do merely 7 to 10 hours a week to do that training. And after 1 year, you get a certificate. After 2 years, you get a diploma. After 3 years, you can even get a master's. And if you get a master's in postgraduate in medical education, you get 5 points for a postgraduate master's, and you get another 5 points in teaching experience because you've done a degree in medical education. So that's how I would, find the right balance. If I'd known about it earlier, I probably would have done it earlier. But thanks to Doctor, who's making these interview videos, that you guys right now know about these before you even begin, rather than find out about it 4 years down the line, like me when I started my specialty training.
And what was the interview process like? You explained how to sort of make up your portfolio and look at the points, but I understand the interview process would have been separate from post-COVID and pre-COVID era, because after COVID, a lot of interviews were cancelled and a lot of people were scored on different other things. But what was the interview? What is the interview process like? If the interviews start again now that the COVID cases are getting under control.
So the interview processes right now are changing. So let me talk you through the application process first, because that might be more relevant. So when you apply, you'll be glad to hear it's a central recruitment process. So you don't have to apply into different parts of the country separately. You go to the central recruitment area, which is called Oriel, and you make up your database there. You don't have to refill your database for all the applications. And then you look for the anesthetic position or vacancy, which is now available online. They usually come out near November time, and also then again in February, because they've got 2 different cycles. So they start, there's one specialty recruitment round in August and the second specialty recruitment round in February. So they start preparing about 4 months or 5 months in advance for each specialty recruitment. The advert goes out. When the advert goes out, you apply in this Oriel system. If you again go into Google and type in Oriel NHS, it will bring up Oriel for you. And you can pre-fill your details even before applying for jobs. Then you apply for the job, and when you apply for the job, it asks you for different details. And all the details it's going to ask you about is your previous experience in NHS, and if you've had any experience abroad, about that as well. What kind of postgraduate medical qualifications you hold, any other postgraduate degrees you hold, if you've done any research, if you've published anything, if you've done audits or QI projects. And it will also ask you about courses in your specific specialty. So if you've done any courses which are relevant to your specialty, it will ask you about that. If you've attended conferences, it will ask you about those. And the whole point of this is so that it can grant you points based on the self-scoring criteria that I already mentioned. Once you finish your scoring side of things, it will then ask you which part of the country are you more interested to apply in. And that is where your research come in. your research comes in where you want to apply for a job, and that is the next bit of your application process. So it will all come down to your competition ratios. If you look into competition ratios, Health Education England publishes competition ratio across all specialties on their website. Let's say you've got an area which has a competition ratio of 2:1, which means for every 2 applicants, they will have 1 seat available in that particular specialty. If there's another area which has a competition ratio of, let's say, 10:1, that basically means for every 10 applicants, they'll have 1 seat available in that specialty. So your chances will be much better in a competition ratio of 2:1 compared to a competition ratio of 10:1 because they've got more seats available for you. Hence, you have to make a judgment call, do your research, and find out which areas of the country are undersubscribed. Now, the catch here is all the undersubscribed area may have a con attached to them. For example, they may be farther away from motorways. They will have a more, let's say, poor socioeconomic status. But that's the kind of things you will be compromising on. If you want to get a job in a higher competition ratio area, let's say London, then you'll have to ramp up your CV a bit better, and you will still be able to get a job in London. And I know a lot of IMGs who applied for and got a job in London. Once you've done that, you submit your application and you'll have a confirmation sent to you. If you then fulfill the minimum requirement for training in anesthesia, they will send out an email to you saying that you've been shortlisted and you will be invited to attend an interview. Now, when you are working in UK, you'll have to be careful. You need to apply for that interview slot very quickly, because let's say that interview slot then falls on your on-call day. You will have to make arrangements for that. So there is a window of about a week within which you need to appear for that interview. So go in, book your slot early, and then you'll be appearing for that interview. When you get a confirmation of your interview booking, they will then send you also the details of everything which is required from you on that day. So they will want a paper portfolio with all the evidence listed in a specific order. Now I'll talk about portfolio a bit more in detail because it leaves the first and a lasting impression in the eyes of the consultants who are sat down and interviewing you. A lot of us will just bring in paper evidence and not arrange them in any order. But I would suggest you have a proper file which looks pretty. Then you have it properly labeled, and you divide it into folders and subfolders, the details of which you will find on the interview invitation email that will be sent to you. They also tell you to be dressed semi-casually, so they don't want you to be too casual, but I definitely suggest you dress up more professionally because it leaves a lasting impression the way someone looks at you in the first gaze. The third thing I would definitely mention is be mindful of roadblocks, train delays, and stuff like that, because you don't want to be caught up in any of that on your interview day. And if you want to appear in an interview, I'd actually try and be there a day in advance and spend a night in a hotel room or something. And all of that is included in your interview expenditure. So you're not paying anything from your own pocket. If you're paying in a specialty interview, that specialty or recruitment office will pay you all your expenses that you've incurred. Well, hopefully you're not going to spend a lot in pubs and cafes, because they're not going to recoup all of that. Now, on the day of interview, when you appear at the selection center on that particular day, they will take all of your details and they'll take your portfolio off you, because that will be then sent to the interviewers who would go through all of your portfolio before you actually appear before them. They'll then match it against the application that you've submitted to them, because they want to verify that the scoring that you've given to yourself is actually correct or not. If they agree with you, then they will just ignore the whole process. If they don't agree with your scoring of yourself, they'll sit down and they'll argue about it. Now, you want to spend minimum time arguing in that interview. You want to spend more time being asked questions so they can award you more points. Now, keep in mind, a lot of people just worry about their portfolio and the portfolio station. But the portfolio station is only 25% of the marks of the whole interview. And even if you have a crappy portfolio, you will cover up for it with the rest of the interview. However, even if you've got the best portfolio, let's say you've scored 40 out of 50 marks on your portfolio station, if the rest of your interview is crap, you won't be able to get any mark. So the next thing, I'll mention all the stations which were there on my interview. Now, mind it that these patterns keep changing, so they can introduce different other stations. My first station was portfolio check, which you sit down with the examiner and they confirm your portfolio self-scoring. The second station I came across was a general interview where they ask you questions. Now, mind you, these are not questions based on your clinical practice. These will be more general questions, questions you probably don't come across in your own countries. For example, they'll say, give us an example from your personal life where you showed leadership skills. And then you sat there and thinking, oh, when was I a leader in my personal life? When actually, if you think about it, you've been leading your family or your friends on a lot of different occasions on a continuous basis. So this is the kind of question you need to prepare in advance for, because you will have examples, but when you put on the spot, you won't be able to come up with examples. Now, other questions they'll probably ask me, they definitely asked me, was about resilience, and from your life, give us an example of resilience. So it will be all about different topics that are essential non-technical skills that they want to see in you in your professional and your personal lives. So keep that in mind when you're preparing for the interview. Another thing I'd like to mention here, which helped me a lot, was the specialty training interview preparation book. I don't know if you've come across it or not. I'd send you a screenshot of that in a WhatsApp so you can share it on your video as well. And that book is really helpful because it tells you how to structure your answers and how to come across very confident in front of your interviewers. So this was my second station where they asked you questions. My third station was my clinical station where they sat me down and we had a discussion, a proper discussion about a clinical scenario. It usually goes on lines of you're dealing with something very urgent and then something else which is even more urgent comes in, and how you're going to manage resources, how you're going to bring in your consultant, how are you going to behave safely as an on-call doctor, and are you able to escalate, delegate, and work with a team in a stressful situation. And that is all it revolves around. So yes, they're looking for your clinical experience, but they're also looking for your non-technical skills over here.
That was
final
okay.
and most stressful interview station for most candidates. The final and most stressful station for most candidates is presenting a poster. So you're asked to design a poster within 10 minutes. They give you a topic extempore. So about 10 minutes before you actually enter the station, you're given a topic. You're given an A3 sheet of paper where you write out all your ideas about the topic. And then you get another 10 minutes to present it and then answer questions. Now in this station, the most important bit was time management. You spend, so if for 10 minutes you get for poster preparation, I would only spend 5 minutes for poster preparation. I'd spend the rest of my 5 minutes thinking in my head how I'm going to present it, because that's all the time you're going to get to prepare for that presentation. For the next 10 minutes for presentation, I would definitely do 5 minutes of presentation and leave at least 5 minutes for questions, because there's specific marks which are designated for answering questions. But if you don't leave that time, you're not going to get any of those marks. Let's decide how good your presentation was. You're going to lose marks if you're not able to answer the questions.
That's great. You know, you've shared your experience and how it was done when you applied for it. I'm sure a lot of IMGs will get benefit from this process, understanding the process, and they can sort of target the next round when it comes around. Do you have any advice for the IMGs in general? You know, if they are working as a junior doctor right now in UK, what should they be doing? You know, in terms of improving themselves. That might not be specific to anesthesia. You know, generally specific to any IMG who is either young or just started or has been in this system for a few months now. What should they be doing?
For any IMG who's come into this country, my first and foremost advice is use your first 3 to 4 months just getting used to the system, really, because a lot of us are caught up in a lot of mess just because we don't take the time to absorb, digest, and bring out the other end what the system is all about. The NHS is a public healthcare system, so it has its restrictions. And one of the restrictions is it cannot spend loads and tons of money. You are not insured separately just on your own. So NHS doesn't want to spend that much money on you, trying to defend you for doing something which might be, to be very honest, a human error. So you need to sit down and see how NHS actually works. You need to learn how to document. You need to learn how to speak to other people. How do you communicate with your colleagues, with other specialties, with your patients? Because a lot of communication over here is non-verbal. And the first thing I found tricky when I came here is and you will find out as well if you come to England. English communication is a lot different from even American or Australian communications. It's a lot of greetings, it's a lot of apologies, and yeah, it's other matter as well. So learn when to say your sorries, and learn when to say your thank yous, learn when to say your pleases. And that makes a huge lot of difference how you come across as a doctor, how confident you come across when you're speaking to patients. Also, make a habit of never misstating the facts, because even though sometimes that seems like a very easy option, but let's be honest, it's wrong and something which should be frowned upon. So if you don't know anything, no one's going to mind if you just say to their face, to be honest, I don't know, I'll find out and I'll let you know. But if you make up a fact, they're going to lose trust and they can start a legal proceeding against you. Now, I've seen it happen to a few IMGs, and I don't want you to be caught up in that kind of mess. Once you've spent 4 months trying to absorb how the system works, then start doing something for your career. See if you already know what you want to do. And if that's the case, that's great, to be honest. But if you don't already know what you want to do here in going into future, then it is worth getting more experience in whatever specialty you want to work in. Because as I said in the beginning, every specialty here is much different from how they work in your home country. So if you want to do cardiology, get some time in cath lab, get to spend some time in electrophysiology, see how things work there. If you want to do anesthetics, spend some time in theater, spend some time with the on-call person and see how they answer, resuscitation calls. If you want to spend time in medicine, go to acute medicine and then go to different branches of medicine, because even if you want to do acute and general medicine, you'll be wanted to do other branches of medicine. Spend some time in clinic and see how patients present and what problems they can offer you. Get used to technology. That will be my next advice, because NHS uses a lot of electronic systems, and if you're used to technology and you're a tech-savvy person, it becomes a lot easier to work in NHS compared to if you're not used to technology, let's say. And the last thing, and I think the least important thing in my eyes, is try to think about your portfolio and try and revamp it for the next future potential job. Why I say it's the least important is because if you already know what you want to do, you'll already have enough on your plate to do that. Don't worry about it. All you need to know is just keep writing whatever you do on a day-to-day basis and reflect on it. Now, reflection is an art. I'm not going to go into too much detail over here. A lot of us just think that an accurate account of what happened is a reflection. It is not. Reflection is basically you thinking about what you did and trying to give ideas to yourself how you're going to make it better next time. So that was a very brief account, but reflect on your everyday practice. And if you've reflected on your practice, you'll have, at the end of 1 or 2 years that you spend here, you'll have enough evidence to prove that you can apply into any specialty. Other things you can do is book into conferences and different courses. You'll have to do some mandatory courses. That's fair enough. If you, let's say, want to do anesthetics, I'd definitely go into 1 or 2 airway courses, which are designed for anesthetists, ultrasound courses, which are very useful, or you can just do acute presentation courses, which is very relevant to anesthetics. To an audit or QI project, a lot of us may not be aware of what an audit or QI project is. To be very frank, when I came into this country, I didn't know what an audit is. I had to sit down with one of my seniors and they talked me through what an audit is. And I felt really stupid then. But if I did not have that chat with my senior at that particular time, I would not be where I am right now. So don't feel embarrassed asking questions. That's another thing you need to know. A lot of people might sound or look intimidating, but if you sit down with them and ask them a genuine question and tell them how it is important for you to know, they'll be more than glad to sit down with you and help you out. I've had head of schools sit down with me and tell me about things which I've asked them about. But if I'd not asked them, they wouldn't even know that I'm struggling with that bit. So don't be fearful of asking questions. And I know in different countries, the education system is very different. And a lot of it is based on, humiliating your students, which is not the case here in NHS. People are very, very willing to sit down with you, help you out. All you need to do is make an appointment with them, give them enough time. So, you don't want to just knock at the door and say, can I have a chat? Instead, send them an email and say, can I meet you at your convenience because I want to discuss X, Y, or Z. Other things you can do is teach. wherever you work in NHS, you will have medical students coming to you, even if you're in the most remote DGH, because this is how NHS works. They do send out medical students to everywhere. And sit down with your medical students, see what they know already, and then try and add on. Have some evidence of your teaching, because your teaching on its own, if you've prepared a PowerPoint presentation, you could have prepared it without even teaching it. Have a very short feedback form, print it out, and ask your students to fill out a feedback form for you. It doesn't matter if it's bad. Even if it's bad, it shows you've done some teaching, and after, let's say, 2 or 3 sessions, if you start getting good feedback, all it's going to show is you've reflected on your teaching methods and you've ended up becoming a better teacher. So that's your evidence of teaching. You can ask your local tutors if you can teach on a course or on a teaching day. That gives you more marks on your portfolio application. And once you become more senior, you can teach on regional training days, which kind of like what I do right now. So I teach on regional anesthetic training days, induction day, and stuff like that. And once you become even more senior, you can be a tutor in courses, for example, ALS, ATLS. These are different research courses that will take you up as tutors and train you to become a tutor in that particular course. Research is something we all get too worried about. I, to date, have no research under my name, and to date have no publication in my name. I'm still managing to get into specialty training in both anesthesia and ICU. Now, you need to keep it in mind that even in UK, research, the training is not that much research centered. For research trainees, there is a specific training program, which is called academic training program. That has nothing to do with the clinical training programs. In the academic training program, they'll teach you medical education, research, and all the managerial bits. In the clinical training program, they will have some weightage for research, but it's not going to be mandatory. So if I was able to get a job without having any research under my name, you'll be able to get a job very easily. Something else about research is it's very easy to do, and it's very easy to publish. You just need to know who you're going to target. You can do a very simple research or a survey of the member of staff, how happy they are with their working hours, how happy they are with the rest facilities. And then you can publish it even locally in the journal of the hospital, and that still counts as a publication. It is not a peer-reviewed publication, but it is a publication, which just tells that you've got some experience of writing stuff. Things we also forget about is extracurricular activities, which hold marks, because what your job interview selection center will be looking at is how you achieve your work-life balance. So have an activity on the side that you participate in. Don't make it work. It is a hobby, okay? So don't try and learn swimming just because you have to, just so that you can get marks on the application. If you like swimming, go and learn swimming. If you like traveling, go and travel a bit, but then make it your hobby and do it more regularly. Because when they ask you, how do you maintain a work-life balance, you need to be able to answer that question with family, with gym, with workouts, with traveling, or whatever is your answer. So a lot of things we get caught out about are some things which you do on your day-to-day life basis, which you do on your day-to-day basis in life, but forget about it when you're in front of an interviewer. So my general advice is take things easy, get used to the system first, and then try and build up slowly. In terms of time, you'll have plenty of it. In terms of money, don't worry, you'll have enough. And to be very honest, having spoken to a lot of consultants, they say if they could be a trainee for 2 or 3 or more years, they wouldn't have minded it. Because once you become a consultant, you get to do a lot of admin work, a lot of paperwork, which is, you know, as a trainee, it's a luxury that you don't have to do all of that.
Thank you very much for sharing your experience and sharing your advice. I'm sure IMGs will find this very, very useful. As you mentioned earlier that you are also doing intensive care medicine, I think we will do a separate interview for that particular bit and to people who are interested in going in that part of the specialty. But thank you very much for your time, Dr. Shifa.